So not everyone considers salivation and secretions to be a really critical issue, but it is. Once there's a buildup, you have a higher risk for aspiration and infection introduction into the lungs and the rest of the body systems. It's a really big deal. It needs more attention, and unfortunately in a clinical setting, you don't always have the time to pay it the attention it deserves. My name's Andrea. I'm a registered respiratory therapist. I've been working with patients for about 12 years now, mostly in a clinical setting. I work in the hospital, in intensive care, and in ER. We find that with some of our patients, especially like our quadriplegic patients that don't have full range or full use of their arms, obviously they have mobility issues and they aren't able to clear their own secretions. So a lot of the times they're dependent on a caregiver to take care of that for them. So they either have to A, notify that person that there is an issue, or B, just hope that they notice eventually. So this is the device that's most commonly used right now to suction patients. And once this tip has been introduced into the mouth once, it's technically tainted, it's dirty, and then if it's set down, it can be picking up bacteria from the bedside table, from the bed, from people walking in and out of the room. We actually had a patient who had quadriplegia and had one of these taped to his bedside rail, and he would just lean over and use it to suction himself whenever he needed it, because he was tired of the burden of having to ask caregivers to provide that service for him. But the amount of bacteria that was probably on that yonker that he was introducing into his mouth with each suction just introduced him to so much infection or the opportunity for infections that it was really upsetting to see that that was what they had to use. Oral care and saliva is a 24/7 issue. It's constantly being produced. So it's split between the respiratory therapists and the nurses to make sure that that's constantly being cared for. Depending on the area of the hospital I'm assigned to, I can have 20, 30, 40 patients, and although you tend to think of ventilator patients as being more critical, a lot of people don't realize that oral secretion, saliva, the bacteria that might exist in your mouth is actually a really critical issue. And there is a greater instance for aspiration, and once that bacteria enters the lungs, you're going to come up with a whole host of other respiratory issues, including pneumonia. And depending on the patient and your immune system, you could end up on a ventilator or worse. So the concept behind SWIK and that you have that kind of 24/7 control over your secretions is incredible. When you put SWIK in the first time, it stays there. It isn't going to be introduced to the bacteria that's in the air or around you or on the surfaces you may set it on. It stays in place for up to 6 hours. SWIK is a great product because it provides a patient with that sense of autonomy. They can provide themselves the care that they need, which is really important. Taking that piece off of my plate and letting a patient handle their own suction 24 hours a day really frees us up to address other issues going on with their care.